Hello everyone, dear ones. Today we are going to have a very interesting live stream together. Please write in the comments how you can see me and how you can hear me. And let's begin. Today's live stream will be dedicated to beauty, specifically to the topic of rejuvenation without illusions, because nowadays, in fact, very many people overuse plastic surgery. We'll discuss what actually needs to be changed and can be changed, what is better left alone, what age is best to start, and so on. And joining us on our live stream today will be a very interesting person, top category surgeon Gennady Patlazhan. He has a great deal of practical experience. By the way, he was the one who helped me with my breast surgery, so this is going to be very interesting. I guarantee that you will be happy with all of this information. All right, now I'm going to bring our guests in and we'll begin. We will also have our curator, Anna Nosikova, joining us today, curator of the Beauty Academy. So let me see if there are any requests. It looks like there's already one request. Let's connect now. Hello, dear.
Hello. You are hello, Valeria Lukyanova. And did you want to speak with Annabelle first or with me?
Well, I think we can all be together. Or yes, let's start with you first. And then we'll also connect Gennady Igorevich.
If I'm not mistaken, Miranabel. We can, right? Gennady Igorovich can join us in about 10 to 15 minutes.
Uh-huh. Excellent. So then what topic should we start with? I know that actually nowadays a lot of people are overusing plastic surgery and it's very fashionable right now, but many girls start way too early. That's why nowadays many of them end up looking much older than their age. Many of them look much older than their age and simply can't stop. This is a huge problem and it's unclear how to solve it because people seem to have become obsessed with it. They are getting full facial lifts, which used to be done at around 50 to 60 years old. And even then, certainly not by everyone. But now people are doing it at 30 and some even at 29. But I consider that almost a child's age and it's very strange.
Yes, I agree. And it's very interesting to hear a professional's opinion, specifically from an aesthetic perspective, how much surgery actually helps. I'm especially interested in whether after 40 or 50, it's possible to look like a young woman, like a teenager. I'm very interested in his opinion because, I haven't seen examples like that. Perhaps not exactly a marker, when the wrinkles are stretched out, when they pull the skin tight, wrinkles or removing swelling. But what exactly brings back that, so to speak, even the appearance, the look, the overall appearance of the face? Because you are actually an example of someone who has not had any procedures done to her face and who promotes natural rejuvenation. And I'm also very interested to know whether there are examples like this, specifically in cosmetology or plastic surgery, because aesthetically speaking, I can somehow immediately tell when there have been surgical interventions on someone's face.
Yes, me too.
I'm very interested because, I've only been on your program for 2 years and I'm incredibly grateful to you, especially for these amazing changes that you give us. And that last course, which works from the top of the head, this is something else entirely. Nothing compares to it. No cosmetic procedure could ever give such a result. Unfortunately, I was a victim of cosmetology. I had problematic skin and I developed major problems after the cosmetic treatments I underwent. Only thanks to you was I able to get rid of them. I would, of course, like to show the example of Annabelle, Mirena's senior curator, so that the viewers can see for themselves someone who has been following your program for decades and simply show the result, how you transform people. And I'm not even talking about the fact that obviously when it's been decades, Annabelle Morena is a clear example. And your clients, even after just 3 months, already show such a huge transformation. Well, I haven't seen results like these from plastic surgery or cosmetology, so I'm also very interested in hearing the opinion of a professional when he joins us.
Yes, that's...
Irina Nabel, please send a request. Maybe Valeria can bring you on as well.
Yes, send a request and we'll discuss this topic. In general, of course, just the face alone. What plastic surgery does to it? Probably it corrects the volume and contours of the face, somehow the skin. But you also need to do something with the body. Pigmentation, for example. How can that be addressed? For example, if the skin is gray, or say if it has this kind of olive color, meaning the lymph is already congested and so on, how can you solve that through plastic surgery? That's also interesting. Maybe there are ways to address it or some procedures. But I very often see women who have had plastic surgery, yet they have such a brown neck covered in pigmentation, their arms look heavy, and you can still see their age. You can still see it.
Yes, thanks to you, I don't have that at all.
My fair skin?
And what kind of skin do you have? Well, I'm still striving, of course.
Your skin has become much lighter, actually. You can really see it. People often say to me, Valeria, you turn on those Chinese filters and become very blurred. But I don't use any Chinese filters. Look at my neck and my face. This is genuinely what my skin looks like. These are not Chinese filters. And they think that because white skin is fashionable among Chinese people. But actually, of course, this is simply my natural skin color. Nothing.
Yes, this kind of glow, no surgery could ever give you this kind of skin glow that you have after following your programs. Because, for example, I don't recognize my own skin at all. I don't think even as a child I had skin like this, so silky, so firm, so beautiful. It cleanses better, becomes more radiant, and there really is no limit to perfection. Marina, Annabelle.
Yes, hello everyone.
Hello, it's lovely to see you, dear. You look gorgeous as always.
Thank you. Yes, that's all. Thank you, Valeria, so much.
Thank you, dear.
So, Milena, yes, I wanted to introduce you for those who don't know you, because you have been with Valeria for many years now. It's actually been decades. You've been following her advice since adolescence. You've been following her advice, and of course, you look like a teenager. I mean, I really haven't seen women your age who could even, as far as I know, there's no way to achieve this through surgery. So today we have a plastic surgery specialist with us on the live stream. Valeria, of course, promotes only natural rejuvenation. And Annabelle, our fitness trainer, is also accordingly an advocate of a healthy lifestyle. And you are so unique in that you have such a deep understanding of quantum practices, which you actually follow even more deeply when it comes to rejuvenation, specifically from the perspective of, well, magic, so to speak. Not even metaphysics, but actual magic. And I'm very interested in hearing about your experience and how much does it help you? Of course, it's clear that this isn't even scientifically established yet, but how does it help you through the knowledge and practices that you apply specifically in quantum rejuvenation?
Yes, well, it's actually quite simple. It's just on the level of, on the level where you understand how your body is structured in general. Many people, so to speak, many people don't believe in chakras, many people don't believe in energy centers, but all of this is very important. And when we understand how to properly manage our energy naturally, it doesn't just leave us. And very often people are told that you should be simpler, that you shouldn't defend your boundaries too strongly, that you shouldn't protect yourself too much. And of course, this also has a significant impact. This is psychosomatics as well, although, until quite recently, I was also rather skeptical about it. But now I understand that, yes, it really does have a significant impact. It's also about emotions. It's simply, a basic understanding of how your body works, not just seeing it as some kind of organism that, excuse me, people simply put different foods into and that's it. That's still the wrong approach, because there needs to be a system, there needs to be proper nutrition, there needs to be exercise, and all of this has a very strong influence. So what's very important here is having the right system. That's how I look at it. And exercise is also part of this, because it is, so to speak, working with energy as well. It's not simply about, building your muscles. Some people find it strange, but there are people who believe that exercise is also, a kind of work with etheric energy. There are also various rejuvenation practices specifically at the level of consciousness, at the level of your brain, meaning at the level of your thinking. This is also very important because if a person has this age program and if you don't remove it, then of course the body will begin to adjust to it, especially since this has already been proven scientifically. Yes, when we, so to speak, program ourselves, when we communicate with our body, all of this has a significant effect on us. So that's how I would answer it. It's a comprehensive process, a comprehensive approach. It's not simply, doing something like, I don't know, injecting something into yourself and forgetting about it. No, that doesn't work. Although honestly, many years ago, I also thought about having something done because I was simply dissatisfied with certain things. In the past, my skin wasn't in very good condition and my cheeks bothered me a lot. I even thought about having surgery to remove these fat pads, but luckily it never came to that.
So, that is probably one of the most dangerous procedures, the removal of the buccal fat pads, because they form the framework of the face. It's precisely these fat pads that support the transition from the cheekbones to the chin. And everyone who has them removed eventually ends up with their face simply sinking in, making them look skeletal. In fact, this happens after the age of 30, even to people who are somewhat overweight. So it's a very typical problem. And when we deprive ourselves of this framework, or even worse, inject.
Let's return to the question about trends. You said that rhinoplasty is currently in first place.
It depends on the country, it depends on fashion, and for example, on the continent. In Brazil, it's the buttocks. In America, it's liposuction. In Europe, it's probably breast augmentation. For us, rejuvenation procedures are very popular, followed by breast augmentation. Rhinoplasty also always remains a trend. In our country, probably in Ukraine right now, since a healthy lifestyle is very popular, body procedures such as liposuction are not as relevant. But in any case, after childbirth, changes occur in a woman's body. For example, there can be diastasis in the abdomen, the muscles stretch during pregnancy, and there can be excess skin and tissue. A woman gains weight initially and then loses it. And of course, things don't always tighten back up completely after childbirth. So women want to eliminate these issues and return themselves to the shape they had before pregnancy and childbirth. These procedures are among the most common.
We often have these kinds of discussions about aesthetics. We really want to hear your opinion. What do you think? What are the kinds of markers, so to speak, that reflect age? At what point is it necessary to seek help?
Well, you can naturally make yourself look younger externally through plastic surgery, although not internally. As for the markers, they are the familiar ones that everyone knows. It's when something starts to sag, when excess starts to appear, bags, folds, wrinkles. These are the things that initially motivate a woman to go to a cosmetologist. And when the cosmetologist says, I can't deal with this anymore, go to a plastic surgeon, that's when they come to us in order to radically eliminate all these age-related changes. Usually that's exactly what brings a woman to us. She says, everything is sagging here, everything is sagging here, my eyebrows have dropped here, Botox isn't helping, fillers aren't helping, threads aren't helping, and none of the other cosmetic procedures are helping either. So my cosmetologist referred me to you so that you could radically rejuvenate me. And then, yes, we step in, perform the surgery, and tell them that for about 5 to 10 years, they simply need to take care of themselves, lead a healthy lifestyle, and visit a cosmetologist to maintain the condition of their skin. That way, the results of our surgeries will remain for quite a long time.
Valeria, I also have a question for you as an expert specifically in natural rejuvenation. In your opinion, is it possible through surgery to make a woman over 40 or 50 look visually similar to a young girl, or is that unrealistic?
No, of course, at that age, I also think it's the ideal age. At least at that point, you can actually see some markers of aging. Nowadays, I think Gennady Igorovich has probably noticed this in his own practice as well. Girls under 30 to 35 come in wanting to have the lower third of their face lifted or the upper third of their face lifted. In reality, there's no need to do this. Their faces are perfectly fine, but most girls are doing it nowadays. And I think that by the time they reach 45, there really might be something wrong. Maybe their skin will have become thinner or, well, I don't know, in practice. But I think looking like a young girl is unlikely, because it's not just the face, it's also the body. There shouldn't be any pigmentation either, because that's also a marker of age. And then there are things like having slimmer arms without excess fat. And I'm also interested in hearing from Gennady Igorevich, when a girl or woman wants to rejuvenate herself, is it enough to work on just the face, or what happens with the body? How can you rejuvenate the body so that it matches the face? Otherwise, you end up with a face that looks all lifted and tightened, while the neck, arms, abdomen, and legs still show age.
You are absolutely right, Valeria. Indeed, nowadays 30 to 35-year-olds are coming in. So personally, in my practice, I refuse about 30% of the patients who come to me because there are absolutely no indications for surgery. They're not really trying to eliminate age-related changes, they're trying to prevent them, but there is no such thing as preventive plastic surgery. You can't just tighten everything to such an extent that, well, the skin is practically stretched to the point of tearing. That's not how it works. So I refuse such patients. As for the body, of course, we can't rejuvenate the entire body, but we do have certain techniques that we use in our practice. One of them is what's called lipofilling or nanolipofilling. This is when your own fat tissue is taken from areas where there is a small excess of it. For example, in women, this would be the abdomen, thighs, and flanks. and it is injected into the areas where the skin needs to be rejuvenated. How does it work? Inside each cell, there are regenerative factors and stem cells, and these are also found inside the fat cells themselves. So we break down the fat cells, and then this emulsion containing these regenerative factors is injected under the skin of the area that needs to be improved. It's not a simple procedure. It's not like going to a nail salon or simply getting a filler injection. It is a surgical procedure, although it is minimally invasive. Most often it's done on the backs of the hands. These are the exposed areas that a woman wants to rejuvenate and that are difficult to cover with clothing, namely the face, neck, décolletage, and hands, particularly the backs of the hands. These are exactly the areas that we can treat using this lipofilling technique when we need to add volume, or nanolipofilling when we need to rejuvenate the skin. That's what we use.
Well, I've noticed that Valeria, for example, teaches how to cleanse the lymph from inside the body through internal cleansing. And for example, I can see that the age-related wrinkles on the hands are disappearing and the neck is becoming firmer. And accordingly, of course, the swelling also begins to go away on its own from the face because, for example, sometime after I turned 30, I started turning to cosmetology and I could already see that basically it was making me look worse. My face started becoming huge and puffy, and age-related pigmentation spots from the peels began appearing very intensely. And of course, after 40, for example, I started looking for other methods, realizing that I was actually harming myself. I also noticed that my head would hurt terribly from Botox and these kinds of procedures. And many of my acquaintances who constantly get injections, I can see that something is not right with their health. They are constantly going to doctors, their stomachs hurt, they feel unwell. And for me, discovering natural rejuvenation was exactly what allowed me to stop all of this. So for about 10 years now, I've been trying to get all of this out of my system. And of course, I can see that the results can really come from cleansing the body internally. This can come from what Valeria teaches, as well as from activating this kind of regeneration. Why, for example, are these people so lazy about it? It also applies to body shape, right? You were saying that in Latin America, it's currently popular. Someone works hard at the gym every day to build their butt, while someone else finds it easier to simply come in, pay money, and have this kind of shape created.
Mm-hmm.
Julia, you're actually answering your own question. There really are no magical rejuvenating apples, of course. There is no one pill that you can take and immediately become young, beautiful, and healthy. But everyone wants to simplify the situation. And of course, what Valeria promotes requires a certain amount of work. You have to put time and some effort into it, but everyone wants to solve the problem quickly, even if it costs money, and even if it costs a lot of money. Nevertheless, they want to solve the problem quickly. Of course, all these training programs that Valeria promotes are very good and they benefit your health. So naturally, you shouldn't start by immediately cutting everything off and pulling everything tight. You should start with what promotes healthy skin and healthy tissues. And then, of course, there comes an age when these procedures and these training programs are no longer enough. Then naturally we step in. But running off at 30 to have everything cut and pulled tight is absolutely wrong.
I understand that there are trends now, right? In your opinion, what is aesthetically more correct? To restore the face's former youthful features or to create new ones? Right now, there is a trend for fox eyes, cheekbones, noses, and so on.
Well, actually, fox eyes are already somewhat outdated. But indeed, every time there is some kind of fashion that brings something new. And most often it is the mass media, movie stars, people who are constantly in the media space, who millions of people pay attention to and want to resemble. And this stimulates certain trends in cosmetology, plastic surgery, and aesthetic medicine, doing something new, being similar to one person or another. But in fact, the modern rejuvenation options that I advocate is rejuvenation in which we do not change the features of the face. We simply return the tissues, for example, that have descended downward to their original position. We lift them and fix them where they were 10 to 20 years ago. But at the same time, nothing is changed. The mouth is not pulled, the eyebrows are not distorted, and the nose is not pulled. So in this case, it simply creates the effect of a fresh face, a fresh, younger looking face. This, I believe, is a classic that will always be in trend.
I wanted to introduce our senior beauty curator, Annabelle. She has also been following Valeria Lukyanova's advice on natural rejuvenation for a very long time, already more than 10 years. She is also an advocate of a healthy lifestyle, a professional fitness trainer, and a vegan. We all are, yes. Thanks to Valeria, we noticed that food also has a very strong influence on regeneration processes because, for example, all our health problems completely disappeared when we switched to some kind of plant-based diet. We no longer have, like before, stomach aches after restaurants or after some kind of feasts. Our hair started growing. You can see that we all have long, shiny hair, not extensions. But as far as I know, I haven't had breast augmentation, and you recently had breast augmentation. Valeria also had it with Gennady Igorovich. I also wanted you to possibly share your experience. And the reason is that I still somehow don't quite understand, plastic. I would like to, I'm afraid, honestly. I am very disappointed in cosmetology. I mean, I am actually against it now, but that's not a rejuvenation operation, right? If it's plastic surgery, that's what I'm afraid of, that I might do something. That's why your experience is very interesting to me, and maybe I'll consider it too.
Yes, hello everyone. So, today it has been exactly 4 months since the operation. To say that I'm satisfied is simply an understatement. And of course, cosmetology, specifically injections, fillers, threads, and plastic surgery are different things. I mean, I even know that many surgeons don't undertake facelifts after SAMAS liftings, various threads, and things like that. Here, of course, there are no fillers that can migrate somewhere. Yes, of course, everything has its pros and cons. There are certain complications, but overall, if a person is healthy, if they have no predisposition to various diseases, there are prerequisites for various diseases, autoimmune diseases, yes, then, in my opinion, there is nothing to be afraid of. The most important thing here is simply to follow the doctor's recommendations. My doctor also keeps a constant watch over me, like, just don't do sports, be very, very careful. One of my patients, after only 2 weeks, already went horseback riding and jumping. So we simply follow all the recommendations and everything will be fine. Of course, now even the cheapest t-shirt or top fits as if it came from the most expensive boutique. And, well, I'm satisfied, at least for now.
Valeria, what do you think about breast augmentation?
Well, I believe that if it doesn't, well, contradict, nowadays there are many very thin girls with simply enormous breasts. And it looks strange. For example, I think Gennady Igorovich will agree. I remember that they also selected the implants for me based on my height and based on my measurements. And Gennady Igorovich said that I didn't need more than 310 because I am very slim. If I had chosen something larger, it would have looked, well, not very harmonious. Therefore, I believe you need to measure the hips and choose the size according to the hips so that it looks right, so that it doesn't look like there is just a stick and then these, like, I don't know, it's not very good. I'm interested in Gennady Igorevich's opinion. Do patients often come to you nowadays asking for something much larger than what their measurements would indicate?
Well, probably nowadays, considering that patients can communicate through all possible channels, Instagram, Facebook, TikTok, Telegram, they probably go to those surgeons with the kind of request you're talking about to put in huge breasts, who make breasts like that. As for me, apparently, word doesn't really get around that I create natural looking breasts, so such patients come to me much less often. But yes, you are absolutely right. The breast should be proportional to the body type, and it is impossible. Well, sort of, it is possible. We can fit the unfittable, as Gorbachev used to say. But is it necessary? Because anything that does not correspond to the parameters of the chest will look absolutely artificial, absolutely unnatural. But sometimes women want this. They want this hype. They want people to look not at them, not at what she says or how she speaks, but only at her breasts. This makes, for example, communication with the opposite sex possibly easier and speeds up the process of getting acquainted. So obviously for these purposes, they do something that is disproportionate. Now we have a very good device called external sizes, with which a woman can see her new breasts during the consultation. Literally in front of the mirror, we put on a special top and place these little pads of different sizes underneath it. And the girl herself sees what she looks like. She can try on some of her clothes and see how she will look with these new breasts. And this is very good. It helps a lot. Sometimes girls come with their husbands. The husband also looks from the side. Oh, yes, this suits you, but this one is too much for you. This is wonderful. We have become so predictable in providing the result that the girl wants, and that is proportional to her, that it makes it easier for her to understand what kind of breast she will get. If previously everyone was afraid, oh, I don't know what I'm going to end up with. Oh, do I need 310 or 350 or maybe 480? Now we actually do a fitting with an accuracy of 10 grams. And the girl sees whether she really likes it and whether it suits her or not. And based on that, we make the choice. So modern plastic surgery has become more predictable than it was before.
Gennady Igorovich, Valeria is accused of having plastic surgery, although apart from breast augmentation, Valeria hasn't had anything done, and absolutely everything is natural, including her thin waist. And how often do people come to you, because many people know you as Valeria Lukyanova surgeon? How often do they come with her photographs, for example, thinking that perhaps you changed something else and say, we want to look like Valeria? And the second question is, what do you think? Should individuality be preserved, or is it better to adapt to the person's request? I want a different face.
Well, Valeria has quite a beautiful figure and well-proportioned facial features, and therefore, naturally, this motivates girls to look like Valeria. So they really do come and say, I want it like Valeria's. There's nothing wrong with that. When a girl is well-proportioned and has a beautiful appearance, then her features, well, these are the right features that we use in order to, well, create something aesthetic. So there's nothing wrong with that. Another matter is when everyone wants to look like Bella Hadid or Julia Roberts or Angelina Jolie. There was a trend, yes, Angelina, when Angelina Jolie, yes? So, well, when with the help of this celebrity that the patient tells us about, we can show some kind of example of an aesthetic norm, an aesthetic standard of beauty, that's good. But when everyone wants to look like the same face, like one breast shape or one buttock shape, well, probably that is not right. And everything should be individual. We cannot make Julia Roberts' face on one woman and yes, Kim Kardashian's buttocks. We still try to approach each person individually and explain that not every face can have its anatomy changed to such an extent that you look like that star. And there is no need for that. Individual beauty is, so to speak, the special feature. It is something unique. And when everyone looks the same, well, probably that is not quite right. You can get lost in this mass of identical faces.
Yes, Valeria, of course, a question for you as well. To what extent do you think one should strive for an ideal avatar while preserving one's individuality and some better version of oneself, or look for examples to imitate and try to look like someone? What do you think, Valeria?
The video was freezing and you were telling me, yes, it was just freezing. I didn't hear you. Well, I think that if a person chooses a star with their body type and physique and everything will indeed look harmonious, then yes. Well, I don't even know. If someone has small eyes, a big nose, and wants to make lips like Angelina Jolie's, then it would be better to correct the eyes and nose first, and only then make the lips. In other words, it should somehow be symmetrical. I think also the person, the star, should be similar in type to the person. If they are completely different and you create a completely different face, then the trend may change later, and the person will have a hard time.
Gennady Igorovich, I noticed that there are a lot of women now who have a similar type of appearance, like Bezos's wife, right? And I even sent you several of your colleagues whose faces, well, I have this feeling that it is like from a movie with Adam Sandler, a comedy, perhaps you've seen it, about plastic surgery, where he tries to drink through a straw and simply cannot even feel where his mouth is. Well, because it looks like, well, like a frozen, stretched out mummy. And it seems aesthetic to me, but this is absolutely my subjective opinion that, well, these faces are a little bit like they were made from the same template. Is this specifically some kind of fashion trend that these kinds of faces are popular now? Or is it an incorrect operation? What is it?
Well, I think it is both. It is a fashion trend, and it is also the fact that the surgeon carries out this request. In other words, they listen to what the patient says and fulfill the request without showing the individual characteristics of the woman that should simply be emphasized and improved rather than changed. But indeed, fashion influences the situation. It influences plastic surgery. And if, for example, I refuse to perform an operation on a woman, that doesn't mean she won't find her own specialist, won't go to the clinic next door, where for her money, of course, they will help her and do what she wants. And naturally, this is why there are identical people with identical faces.
Yes.
And Annabelle, I also have an interesting question for you. Are you still thinking about any additional plastic surgery procedures, or are you satisfied with everything? How do you look ahead and think about it?
Yes, I am thinking about two more. One is on my face. I want to correct my nose a little bit, so to speak, both aesthetically and Well, slightly. In short, I have my own little issues there. It doesn't matter. And internally, it turns out that my one nostril is so large that you could practically fit your whole finger in there, while the other is very narrow. Even when they took a COVID test a long time ago, that thin little swab couldn't even fit into that nostril. It was very narrow. So the septum is deviated. And there is one more operation on the body. I won't say yet what it is. I have been hiding this problem for many, many years since childhood. So when I have it done, then I will show it.
Interesting. You surprise me, honestly. It seems to me that you have such an ideal appearance and you are a role model for many of our students, just like Valeria. You said that you found some imperfection in yourself that you want to correct.
Women, we will always find something in ourselves. But in principle, the second one, yes, it does interfere with my life. It is my problem. So yes, I simply hide it very well so that no one has noticed it so far.
Mm-hmm. And to you, our dear experts, Valeria Lukyanova on natural rejuvenation, Gennady Igorevich, plastic surgeon, what do you think? Is this something psychological in the mind, some kind of necessary psychological issue that requires some kind of urgent intervention? Or is it actually a surgical problem that really needs to be addressed and corrected?
Well, indeed, most often the problem is psychological in nature. Why? Because again, a woman can live her whole life with small breasts, right? With different sized nostrils. You can live your whole life with that, right? It doesn't mean that, well, you are going to die from it tomorrow, right? So it is an aesthetic problem, but simply the modern level of plastic surgery, which has become safer and more predictable, allows these problems, which in principle can be quite serious, to be solved fairly easily. Because of this, attitudes toward plastic surgery have also become somewhat more relaxed. Instead of trying somehow to psychologically deal with this particular aesthetic problem or going to psychologists or simply getting these bad thoughts out of her head, a woman thinks that it is much easier to eliminate this aesthetic problem with the help of plastic surgery. It's not. In most cases, the problem is psychological in nature. Why? Because, well, again, a woman can live her whole life with small breasts, right? With different sized nostrils. You can live your whole life with that, right? It doesn't mean that, well, you're going to die from it tomorrow, right? So it's an aesthetic kind of problem, but simply the modern level of plastic surgery, which has become safer and more predictable, allows these problems, which in principle can be quite serious, to be solved quite simply. Because of this, the attitude toward plastic surgery has also become somewhat simpler. Instead of trying to psychologically work through some aesthetic problem or going to a psychologist or simply getting these bad thoughts out of their head, a woman thinks that it is much easier to eliminate this aesthetic problem with the help of plastic surgery. But when they come to us, we are, so to speak, the first link that meets the patient and can determine whether this problem really has a psychological nature. We have such a diagnosis called body dysmorphia. This is when a female patient comes in with beautiful, absolutely normal, correct features of her face, body, and limbs, but she thinks that one of her arms, for example, is slightly longer than the other and wants to shorten it, or that one ear is bigger and the other ear is smaller. In reality, we see that, well, this problem isn't worth a damn. This is absolutely not the kind of problem that should be solved with a surgical operation. Naturally, we refuse such patients and refer them to psychologists. It's not a fact that the patient will actually go to a psychologist. Again, they may find their own person who will correct that ear or arm for them. But indeed, most of the problems that our patients come to us with can be eliminated through working with a psychologist who will simply show you your problem. On the other hand, they will explain that you don't need to pay attention to some minor nuances, like, well, the tip being slightly wider than the bridge, or one nasolabial fold being slightly deeper than the other. Well, that's really nothing, right? You can absolutely live peacefully, live happily, enjoy life without correcting this defect, which seems catastrophic to someone, while someone else doesn't even pay attention to it. Therefore, usually we work as a team, a plastic surgeon together with a psychologist. And in this way, we help our patients. When we see that there is no need to have an operation, we will not perform it. We will refer her or him to a psychologist in order to solve this problem in a non-surgical way.
It's better to send them to Valeria Lukyanova.
Of course.
And what problems are actually the kind where you clearly understand that something needs to be done, apart from, say, sagging of the face, where everything is clear? For example, a person wants to somehow correct their facial features. In which cases do you really think it is worth doing or not? Let's say there is a small hump on the nose, but in principle it does not spoil the person's appearance, but they want to correct it. Do you think it should be done or not?
I discourage such patients If I don't see that the deformity is really, well, if this deformity spoils the face, if it really does not conform to certain aesthetic canons of beauty, then yes, we understand that an operation needs to be done to eliminate it, and the patient will be happy. We want our patient to be happy after the operation, to like what they have done, and to get pleasure from it. That is the main goal of all our operations. But if we see that aesthetically absolutely nothing will change, like a small hump or a small wrinkle, then, well, there is no point in doing this operation. But pronounced deformities really do matter. For example, when patients come with protruding ears, with ears like this, or a girl comes and says, I want to have a hairstyle where my hair is pulled back. I do dancing, for example, and I need my hair to be pulled back. And I always wear my hair down because I have a complex about my protruding ears. So in reality, by doing the operation and eliminating this insignificant but actually real defect, we help this girl feel much more comfortable doing sports, pursuing her favorite activity, and everything else. When there is some kind of hump, when the nose is crooked after an injury, yes, we understand that this is really a problem and it is better to correct it. But when a girl has already had 3 rhinoplasties and says, well, I still want the tip to be, well, half a millimeter different, a little higher or a little lower, we explain that not everything is within our power, that human tissues are not rubber that can be stretched, nor are they plasticine that can be molded, and that there are certain limitations in our work. And we explain that it is not worth doing this, it is not worth chasing some ideals or some minimal changes in your face. And naturally, we refuse such patients.
Yes, that makes sense, of course. Valeria, your 3-month course starts soon on September 1st. It is legendary for many people because you have changed the appearance and lives of many thousands of students. Tell us literally, if a person still wants to, well, before any surgical interventions, follow some recommendations, what result can they already see on your course in 3 months? What changes, at least externally and internally, can they see?
Increased energy, improved tissue regeneration. By the way, if a person still wants to see a surgeon afterward, after my course, their regeneration will be faster, everything will heal quickly. So, roughly speaking, it speeds up all the systems of the body. Because I remember when I myself had surgery, there is such a recommendation: don't drink, don't smoke. So if a person has a lifestyle where they have many bad habits and don't exercise, then everything heals slowly. In this way, a person gets rid of unhealthy eating habits. Many people stop drinking and smoking because they simply no longer want to. And of course, the hair grows, the skin becomes lighter, there is a good mood, motivation, all the things that, roughly speaking, youth gives us. When we are still full of energy, we have drive. Then the body slows down and a bad mood begins. It becomes difficult to get up in the mornings and so on. These are the kinds of markers that can be addressed.
As far as I know, you prepared Annabelle, I think, before and after photos of the participants. It would be very interesting to get the professional opinion of Gennady Igorovich, to look at them and determine whether plastic surgery was performed or whether these are, for example, some Photoshop edits. The changes are incredible.
Yes, it was difficult to choose because all these photos are on our website. So there are very, very many of them. I chose the most striking ones. So, for example, I'll enlarge it now. Will the girl be visible?
Could you bring it a little closer? It's somehow the light. The light is reflecting there, unfortunately. Yes.
Maybe it's not visible, right? But without the light, then I won't be visible.
You can turn it on afterward. Turn it off first. Yes, show it now.
Yes. And by the way, we can immediately say what else can be corrected with plastic surgery. If Gennady Igorovich can see it with his professional eye, as I understand it, the first one is after, right? And the second one is before.
This is before, this is after.
Okay.
Do you see the difference?
Well, of course I see the difference, but actually these are somewhat inaccurate photographs because the before photo was taken with different lighting, which slightly distorts the picture and masks some of the changes on the face. But yes, you can see that the face after looks much fresher and there are fewer age-related changes. But this is why we photograph our patients in standard positions with standard lighting against a standard background with the same camera from the same distance and in the same positions before and after, so that these comparisons are accurate and honest, and then you can really compare them. And when there are changes in the lighting, unfortunately, not everything can be assessed clearly and correctly.
They all actively use social media, so they post about the program and their results. Basically, almost every day, showing how they have changed. And this can be seen very clearly. By the way, I'll show a photo. Look, see what a difference. So, yes, indeed, it's a great effect. Absolutely. What kind of breakouts did you have? And just look at what a different face you have after 3 months.
Of course, the effect of cleansing the skin, of detoxification, is a great effect. It's super. So, when there are no breakouts, when a person's body mass index corresponds to their height, that's very good. That's a healthy lifestyle.
Look, mother and daughter, these are practically two completely different faces. Look at how a person can become younger.
Yes, a great effect. So when you undergo proper wellness treatment, naturally the face also looks healthier. I absolutely agree. And yes, these are great results that you are showing.
Okay, thank you. Maybe you could also show some results that you consider simply exemplary, results that you use as a benchmark, and perhaps consider the very best results in your practice.
Well, I didn't prepare, so I didn't bring any.
You can send them later and we'll show them, perhaps results on the body, maybe also on the face, so that it will be possible to see what the rejuvenation program looks like from the inside and outside, how everything looks, so that people can understand what is better for them and how they should proceed from there.
Yes, I'll send you the options of those patients who have allowed me, of course, to demonstrate their faces, because not everyone gives permission. But I'll send you the ones who have allowed it, and you'll be able to show them.
Yes, on our website, valeria.com, you can also see the full-length, large broadcasts with all these participants who are, grateful to us all for changing our lives, our appearance, and giving us such confidence. It seems to me that, no amount of money can replace these feelings. We have a lot of successful women, ourselves included. And when you look in the mirror and realize all of this, you no longer have that youthful energy. You no longer have the same face, the same body, and there are constantly some health problems. And actually, you are truly ready to pay any amount of money. I understand why women pay such large amounts of money for cosmetology and classical surgery, but if you can truly rejuvenate comprehensively, including through what Valeria Lukyanova promotes, when you see such incredible changes, in my opinion, well, surgery will never be able to do exactly that. I mean, surgery helps to correct things, but it cannot comprehensively rejuvenate you, cleanse the body, and produce such a comprehensive result. And that really is worth any amount of money in the world. You simply give everyone a new life. Look at how active everyone becomes, how they start working on different projects and businesses. In other words, this incredible amount of energy appears in everyone. And I, of course, understand that it's all, well, for women, I think for men, probably this aspect is important too, but for women especially.
For men, we talked about this. Do more men now use rejuvenation services in general, or let's say facial correction? Men are also taking more care of themselves now.
Yes, men have indeed started coming to us more often, and they really are taking better care of themselves more often. So if previously we said that about 5 to 10% of those who came to us for facial rejuvenation were men, now I think it's about 20%. So the number of men has really started to increase.
Yes, that is certainly good on the one hand, because men didn't really take care of themselves before, but sometimes it happens that they also demand much more than they actually need, or they, in this regard, they rely on your opinion.
Well, with men, it's actually a little easier. Women still strive for some kind of super ideals, while men want to get rid of some fairly pronounced age-related changes. Therefore, it's a little easier to communicate with men. It's rare for them to be radical, like someone over 60 coming in and wanting to look 18. No, that doesn't happen. Well, by the way, regarding your practice and the course you conduct, that's good. But look, if a woman over 60 comes to you when, well, she already has a whole bunch of chronic diseases, the hormonal background is already completely absent, but she wants to look younger and everything is sagging on her face. In this case, practices probably won't help much, right? I mean, you can improve her health from the inside, but unfortunately, in such cases, when everything has already been neglected too much, she can't do without us. Therefore, when everything is done comprehensively, then it works much better.
Well, yes, in this case, I would suggest first cleansing the face and improving regeneration. And if that still doesn't help, then you can have a lift, and then it will last much longer than if a person simply has everything tightened right away while the body itself remains in a neglected state.
Yes, preparing for surgery is one of the main important factors that we absolutely tell all our patients about. The better prepared you are, the healthier your body is. the longer the effect that we can create for you will last. Therefore, yes, if the preparation is done through some of your practices, or for example, if maintenance is also continued after our surgery, then great, we get an excellent effect.
Yes, this will really work very well. And it's interesting to know you say that sometimes women come in wanting to look like young girls. What was the craziest request for rejuvenation you've ever had, and to what extent were you able to fulfill it? What was your most impressive example? For example, a woman of 40 or 50 came to you, and in the end, how were you able to rejuvenate her if her request was to look 20?
Well, there have been different cases, but one interesting case was when a 50-year-old woman came with her young boyfriend, who was about 24 to 25 years old. And she said that they wanted to get married, but she was afraid to go and meet his parents because she was slightly older than them. And the task was to rejuvenate her in such a way that, first of all, she wouldn't be embarrassed to go to meet his parents. And secondly, so that she would look young enough for their wedding photo shoot to be truly beautiful. And she succeeded. She later sent me their wedding photos. She looked gorgeous. Well, practically about the same age as her partner. And cases like these, when you can change a person's life, their destiny, are really wonderful.
Super.
And I would probably suggest that we move on now. We've already been going for more than an hour. I would like to ask all of you one final question. Tell me, if a woman or a man wants to see a healthier, well-groomed, younger-looking version of themselves in the mirror in 3 months, with a more toned body, what do they need to start doing today? Probably the first question to you, Gennady Igorovich, then Annabelle, and finally Valeria.
Well, again, it depends on the person's age and, yes, the state of their health. If the body is neglected, if there are a lot of chronic conditions, if a person doesn't get enough sleep, if they lead an unhealthy lifestyle, have a poor diet and bad habits, then probably we need to start with that, yes, meaning prepare your body. And if that helps, then great, enjoy life. If we see that an older person comes to us who unfortunately already has certain chronic illnesses, which we understand cannot be completely eliminated, then in any case, we should at least reduce their severity, improve their health somewhat, and then come to us so that we can help them look younger and more beautiful.
Uh-huh. Maybe exercise or vegetarianism. Have you noticed in your practice that vegetarians heal faster, or people who exercise, or those who don't drink? In other words, do people who lead a healthy lifestyle have better results after surgery, or is there no such statistics?
Well, as for vegetarianism, there are certain nuances here, because for tissue healing processes, we do need protein. And if this protein is exclusively plant-based, then it's not always possible for the patient to heal quickly. This is more relevant for major extensive operations, such as abdominal plastic surgery and breast surgery. In this case, we actually recommend that for a certain period of time, if you are vegan or vegetarian, you switch, meaning get some protein of animal origin for a while. It can be powdered protein, for example, but nevertheless so that everything heals properly, and then you return to your usual diet. This sometimes causes complications for us, so we pay attention to this. But if it's an operation in the facial area, then here, well, it doesn't harm us that much. But with major extensive operations, we do pay attention to this, yes, making sure that the diet includes protein, specifically animal protein.
Uh-huh. It's just that we also have a whole lot of plant-based protein substitutes. And I've noticed that tissues regenerate and recover very well. I really can't say anything about operations, but I remember when I had my breasts done, and since I had implants placed under the muscle, it was quite a traumatic operation. I was vegetarian and I didn't even have a single bruise. I was actually sure that my entire chest would be covered in bruises. I didn't have even one bruise. I was very happy about it, but I wasn't consuming animal protein.
Well, excellent, a good example. But again, how old were you at the time, Valeria?
Around 23 to 24, I think, something like that.
Well, at that age, all of your body's functions are still working so well that it's very difficult to harm them. But when someone is already 45 plus, then there can still be a deficiency of something. Yes, you can replace things with alternatives, but there are essential amino acids that can only be obtained either artificially or through animal protein. So in some cases, this does matter. Although indeed vegetarianism is beneficial for the body, I absolutely agree with that. But sometimes it can interfere with surgery. Therefore, it's always better to consult with your doctor, always discuss it with them beforehand. So there is a question of how much your diet can help or harm you after each specific operation.
Yes, we have many vegans and vegetarians, and comments have already started coming in. I don't eat meat, and everything went well after the operation. I had a stomach ulcer, the incision closed and healed quickly. I was 39. There are many comments like that. Someone, for example, talks about their teeth, saying that they had a tooth removed and also had swelling.
It's just that, you see, there are different kinds of vegetarians. Protection of plant-based protein. There are simply vegetarians who eat only salads, but I, for example, take a lot of supplements. Here, by the way, Amina, I have a whole pack of them. I have a lot of them. I'm constantly taking supplements in huge quantities. So they are both for vegans and for ordinary people. Therefore, I probably even have an excess of them.
Yes, I have nothing against supplements. I mean, if the body is lacking something and it isn't getting it from food, then naturally you need to replace it with something. These are the micro and macronutrients contained in these supplements, which provide what we cannot obtain through our diet and food products.
Right? So you are basically in favor of supplements because many doctors say, why do we need supplements? We have food. But nowadays, our diet is such that we promote taking a lot of supplements.
I'm for common sense. If the diet is, well, super healthy and properly balanced, then perhaps the amount of supplements will be minimal, if they are even needed. I, for example, take them myself. I don't take supplements, but I do take multivitamins. So they also contain certain micro and macronutrients that, well, we cannot get in sufficient quantities from food. Otherwise, you would have to eat enormous amounts of products that would be harmful to our body, rather than taking, say, a certain amount of either a multivitamin or a supplement so that our body receives a sufficient amount of everything it needs.
Yes, I completely agree. There's just so much carrot, broccoli, and other food you would have to eat to get the necessary amount of beta carotene. Here, you just take a couple of tablets and that's it.
Yes, before your program, I didn't even know about supplements or try them, but now I understand that, of course, this is what our entire body, our youth, is built from. And with the programs you provide, for example, hair awakening, when you see such an immediate result with the hair, a reduction in swelling, a reduction in the face, since you give exactly these kinds of supplements, these kinds of programs, it's all so easy. And in fact, our taste receptors have changed too. We all had unhealthy habits, but when the body gets cleansed, we no longer want them. Meat becomes unappealing, and the smell of alcohol, the smell of cigarettes. So everyone gets rid of unhealthy habits very gently. The body itself, as if on its own, starts asking for a lot of fresh kinds of foods. The taste receptors completely change. The microbiome gets rid of these harmful things. You can literally feel what the food is even made of. If something harmful to your body has been added, you can tell. And what surprises me now is that with such a good cleansing already, practically on a permanent basis, I've noticed that I don't want anything sweet at all anymore. Somehow I don't even want it. Even sugar substitutes have become unpleasant to me now. I don't even like the taste anymore.
Yes, I understand you. Same here. By the way, I just remembered a very important question, which is interesting since in the past, stem cells were transforming into cancerous cells, but in principle, many celebrities use them for rejuvenation. So, how much has this changed now, or are many people still, well, concerned about stem cell therapy? Do you practice it, or are there still no safe methods?
There are no safe ones yet. But naturally, if we use autologous stem cells that are found in fat cells, and we don't inject them intravenously, but instead inject them into tissues, then we do not alter the structure of this stem cell. When a stem cell is taken and then grown in a laboratory, and then millions of these stem cells are injected, no one in medicine can yet guarantee that among these millions of cells, at least one will not be damaged, and that this damaged cell will not actually cause the growth of cancer and other types of tumors. Therefore, unfortunately, medicine has not yet reached the level where we can directly use stem cells to grow a new liver, a new heart, or some new tissues. Well, science is moving forward. A huge number of experiments are being conducted. Research is being carried out, specifically aimed at enabling the body's own cells to rejuvenate and eliminate the diseases that exist in the human body.
Oh, by the way, this is very interesting on this topic. I saw a study that, well, only recently they have started studying the female body in greater depth, and it turns out that women's menstruation is not dirt, but literally liquid gold, containing a huge number of these very stem cells that are capable of growing new organs. What do you think about this?
I don't think anything, I haven't conducted this research, so unfortunately I can't tell you anything.
Mm-hmm. So this is probably only just beginning. And regarding peptides, perhaps you do have an opinion after all, because nowadays many people even inject peptides during live broadcasts, not just as supplements, but directly into the bloodstream. How do you feel about this? Do you have experience specifically with peptide rejuvenation through injections?
Polypeptides and nucleotides are indeed a popular topic right now, and we really do see certain advantages in using these preparations, but not as a replacement for, say, plastic surgery, but as an aid to plastic surgery. For example, after eyelid surgery, working with polynucleotides is very relevant. When a cosmetologist injects polynucleotides into the area that was operated on, we see a great healing effect, really an effect that we hadn't seen before. Previously, we didn't know about these preparations, but now they are actively being used. We even prescribe them ourselves. For example, about 2 weeks after surgery, you should undergo a course of biorevitalization or mesotherapy using these polynucleotides. And we see that regeneration happens faster, swelling and bruising go away faster, and the scar heals more neatly, becoming practically unnoticeable. And it really is a very interesting topic. And personally, I'm in favor of it because I see the effect of these procedures.
Mm-hmm. And what if it's just for rejuvenation? For example, without surgery, would there be the same kind of effect? And which brand would you recommend, in your opinion, as the safest of these preparations, and what are they called?
That would be advertising. So we're not going to advertise any companies here.
Mm-hmm.
As for using them instead of surgery, well, probably they won't help as a replacement for surgery. But again, like all cosmetic procedures, they work at a certain stage. At a certain stage, you can achieve some kind of effect with a cosmetic procedure. You can do a simple biorevitalization, for example, with amino acids all over the face, and you will get some kind of effect. But how long-lasting is this effect? How pronounced is this effect? And how safe is this effect? How likely is it to cause an allergic reaction to these preparations? There are many factors, and therefore not everything can be eliminated with the help of some new preparations. Believe me, every year more and more of these preparations appear. New devices, new threads, new procedures, and still, for some reason, they haven't found that gold standard yet. The injection that you get, and that's it. You immediately become young and beautiful. Why? Because unfortunately, not everything is that effective yet, but there is some effect. We use this effect. We recommend, for example, these preparations, but so far they cannot completely replace surgery. And thank God, probably, because for now we still have work to do. But thanks to these preparations, we improve the quality of our surgeries.
Great.
By the way, there was a question from a viewer. I'm 54 years old and I want to have a facelift. What is your opinion, Gennady Igorevich?
54 is exactly the age, as I said, when it is already appropriate to undergo some kind of rejuvenation, if you want to, because this is still a borderline age when the effect we achieve can last, well, up to 10 years. So why not? If your health allows it and your physical condition allows it, then go ahead and do it.
Mm-hmm. And I'm curious, which countries are you currently working in so that people who want to contact, whether it would be suitable for them or not? And do you offer online consultations?
Yes, of course. For example, yesterday I consulted one patient from Canada and a second one from Australia. And I was doing all of this while being in Chisinau, for example. I operate in Odessa, Ukraine. I have my own wonderful clinic. I also I'm invited to operate in Chisinau, which is Moldova, and in Riga, Latvia. So these are the 3 cities and 3 countries where I perform surgeries. And online consultations are, of course, possible. There is a way to book a consultation with me. My Instagram channel has a phone number there.
Mm-hmm.
You can call and book a consultation.
Yes, definitely.
Mm-hmm.
Valeria, would you recommend having a facelift at 54?
Well, we still need to see a photo, but if there is a lot of excess skin, then I would probably do, so to speak, both internal rejuvenation and external rejuvenation. That is, so that everything is, roughly speaking, perfect right away, so that it isn't the case that you only tighten the outside, while there may be some other negative consequences in the body. So if you prepare a little, cleanse yourself, go ahead and have the procedure done. I think the results will last for many years. Mm-hmm.
And you also didn't answer the final question. I thought I had asked it, but is it possible to change within 3 months? And what does a person need to do if they want to completely transform themselves in 3 months.
Yes, of course. Well, the most important thing here is to start the changes from within, change your lifestyle, your way of thinking, start exercising, do some exercises for the face. And basically, in 3 months, there will be an amazing result. If you want something else, yes, if there is excess skin that has not gone away. We rarely encounter such a situation where the skin actually remains hanging like that. But if this happens and the person is still dissatisfied, then you can go and have additional correction. But then the result will already be not only on the face, but also on the whole body and in terms of energy, the energy in the eyes. So it will be an absolutely amazing result.
Well, I want to remind you that, yes, on September 1st, Valeria Lukyanova's legendary course on natural rejuvenation begins, where over 3 months you can see the results, live broadcasts, the long broadcasts on the students' website, their reviews, and of course, make your own choice.
Yes. And also, of course, if there are already such conditions where liposuction, a lift, abdominoplasty, breast augmentation is needed, I highly recommend Gennady Igorevich as a professional, because I myself had it done by him and was very satisfied.
Thank you very much. Yes, if anyone is interested, please get in touch. Online consultations, in-person consultations in 3 countries are available. Sometimes you can even simply send a photograph. I will make a preliminary assessment of the situation and say whether, yes, we can work together and either, for example, go on Valeria's course, or you can actually come to us and then go on the course. But of course, it is better for the body to be cleansed and prepared before any operation. The better the state of health, the better any operation will go.
There, yes. Thank you for coming on the broadcast. We also invite plastic surgeons and cosmetologists. We regularly hold live broadcasts talking about rejuvenation. We ourselves are naturally very interested in this niche in which we are developing. And I think such broadcasts will also become frequent and regular for us. And we will be happy to have you as an expert and answer the questions of our viewers and students as well.
Yes. Thank you, Gennady Igorevich, for joining us today. It was very interesting, and I think many people understood how best to change themselves, that there is no need to rush, that everything needs to be assessed carefully, and that you should only work with aesthetic specialists who will preserve your individuality and simply be able to give you back years of youth and beauty.
Thank you very much for inviting me, and good luck to you.
Thank you very much.
Goodbye.
Take care. Yes, goodbye.